If you take medication and avoid troublesome foods but still have symptoms of heartburn, you may be suffering from something else, and it's something a lot of doctors may not be checking for.
HealthBeat reporter Sylvia Perez joining us with more tonight in a special segment.
Kathy and Ron, acid reflux, more commonly known as heartburn, is more than an occasional nuisance. It is a problem doctors can diagnose and usually treat effectively. But now there's another kind of reflux disease showing up. It may explain why some people on medication don't get better. They're the usual suspects: fried or fatty foods, coffee, alcohol, garlic. Many types of foods can trigger indigestion. So can overeating, being overweight, even smoking increases your risk of heartburn.
Burning sensation, a lot of belching.
Olivier Handbuckers knows a lot about heartburn. He's not only a patient, but a registered nurse in Northwestern's gastroenterology department. Years of stomach juices bubbling back up into his esophagus have caused damage. He is now on medication to control the acid. But sometimes, mysteriously, the reflux returns. Dr. John Pendolfino suspects Olivier also has something else going on, what's known as non-acid reflux disease.
Yeah, in the general scheme of things, it is something that is often overlooked.
That's because in most cases, doctors are looking for stomach acid as the culprit. Neutralizing it with medication usually takes care of the burning indigestion problem. But controlling the acid may not always stop the reflux. Other liquids from the stomach could still back up into the esophagus. The result? Symptoms such as chronic cough, asthma, indigestion, even regurgitation.
So any movement of this gastric juice outside and into the esophagus and above is going to give you some symptoms.
Not until recently have doctors been able to test for non-acid reflux. That's because typical monitors depend on acid as a signal. Now, newer monitors like this one can detect reflux when there's no acid present by measuring electrical resistance in the esophagus. This technique is called multi-channel intraluminal impedance, or MII.
I can actually see liquid and gas move from the stomach into the esophagus. And then I can actually go back, independent of what the pH is or the acid level, and correlate that reflux movement to the symptoms.
For this test, a catheter is placed from the nose into the esophagus. A patient then wears the monitor for 24 hours. Getting the right diagnosis may mean different treatments. With non-acid reflux, lifestyle changes such as eating smaller meals or losing weight may be enough. Surgery is also an option. Dr. Marco Patti at the University of Chicago Medical Center says in more severe cases, the right diagnosis could even prevent long-term damage to the lungs.
We know that there are some patients that can have so much damage to their lungs due to reflux they can develop fibrosis.
Olivier is now considering the MII test.
Is it fluid? Is it acid? I don't know. But, it does still happen once in a while that I feel those symptoms that I felt.
Now, devices to check for non-acid reflux have been around for several years now, but because of the cost and time commitment needed, not all hospitals offer these tests. Experts say if you are on heartburn medication but still experiencing symptoms, you should speak to your physician about other possible causes. Ronnie?